Alright guys, today we're going to be talking about BiPAPs and how to set those up properly. Um, so yeah, let's get to it. So pretty much you know how to set it up. It's fairly easy. If you don't know how to do that, then I'm sure there's another YouTube tutorial that shows you how to do that. But anyways, you got the basics, you got the circuit, you got the pressure line. It goes to the pressure thing on the pressure port on the BiPAP itself. We're talking about the Vision BiPAPs, not the V60s or any of the other ones. And then you got the exhalation port that goes with it. Then if you want a nebulizer in line, you got a nebulizer in line. Then you got the masks. There's different types of masks, different sizes for the fitting. You got the normal mask that covers the nose and the mouth itself. Then you got the nasal mask, just covers the nose. Then you've got the full face, the Freddy versus Jason type mask that Mr. Porter was talking about. Then you got the hockey style mask, which is just like this. Yeah. And then different fittings. They said you don't want it on too tight. You want a little bit of a leak, less than 25% leak when you go to the parameters and look at it there. That's all there is to that. Different brands have different types of masks and the way they look, but they essentially do the same thing. They got exhalation ports. You can breathe in, breathe out fairly easily. You turn it on from the back button. There's a little flap. You press the white button. It turns on. You turn on. You do the short self-test that they have. You occlude the port, and you do basically follow the directions on that. And then once that gets set up, then you got to pick a mode. You got CPAP mode and you got spontaneous time, which is essentially the BiPAP mode. And then CPAP mode, you just set the pressure that you want, just like with the CPAP machine. And then with the spontaneous time mode, you can set any of the rates, the inspiratory pressure rate, the expiratory pressure. You could set the rate, the inspired oxygen, the FiO2. You can't set the pressure support because it's IPAP minus EPAP. So whatever you set those to, you do the math. IPAP minus the EPAP gives you the pressure support. And then you got the minute ventilation that they show you in the monitoring mode, the bottom. You got the tidal volume, it shows you the percent leak. You got the rise time you can set up, which is how fast it blows the air in for the patient. And then you've got the PIP, it shows you. And PEEP is essentially EPAP. So whatever you set EPAP is PEEP. Same thing, two different words. I don't know why they do that. But whatever you set the IPAP, let's say you set it at 12. You put it on the patient, and then you look on the IPAP. It says 14. You set it at 12, but they're breathing faster or breathing harder, pushing harder. It increases their IPAP, which that reading is PIP, peak inspiratory pressure. And then you've got the alarms. You can set the high pressure, low pressure, apnea, low minute ventilation, the high rate, low rate alarms. The rate alarms you set 2 to 3 above what they're actually breathing. And then the high pressure, low pressure alarms, just 2, 3 also, above and below what you have set it at. What you have is initially set. I suppose the doctor orders 12 over 6. Set the high pressure alarm to 15, low pressure to, I think the lowest it goes is 4, I think, so 4. Yeah. You configure it to the patient. You set there, get it set up for them. Don't just put it on and leave. And now if you have if the patient has, let's say, ventilation issues, you put them on the BiPAP. Doctor's orders are 12 over 6, for example. Put them on the BiPAP. 30 minutes later, you draw an ABG. Their CO2 is still, on the high side. You've got like 50, 59, 60s even. that means it's a ventilation issue. They can't get it out fast enough. So the setting you would increase is the IPAP, the top pressure. You could also increase the rise time, which pushes it in there faster and also gets it out faster so they can breathe a little bit better, I suppose. And then if they have a perfusion issue or oxygenation issue, atelectasis, any kind of issues like that, shunting, you would normally increase the PEEP. But in this case, the PEEP is the end EPAP. So you'd increase the EPAP. Now, when you're changing the IPAP and the EPAP values, keep the gradient between the two numbers greater than 4. Let's say you don't keep it like 10 over 8. You're not having a much of a gradient for the BiPAP to be effective. And then let's say you want the ideal setting is keep the gradient at a 4. For example, 12 over 8 or 10 over 6 or 8 over 4. Those all have a 4 gradient. Now, if they have a ventilation issue and you have to increase the IPAP, it's not necessary that you increase the EPAP just to maintain that 4 gradient. For example, if you have 8 over 4 and they're still not ventilating properly, you can increase it to 10 over 4. You can increase to 12 over 4. But when you start to get to those high gradients, when you don't have it like 16 over 4, that's a pressure support of 12. You don't want that. If you have to raise the IPAP in such a way that has a higher gradient, give them a little bit of EPAP, add it up. Don't have such a high gradient between those two. It's just not comfortable for the patient. What else? Complications. Complications for the BiPAP. You've got, if it's too tight, it's not doing its job. There has to be a little bit of leak, but not too much. If it's too loose, you got too high of a leak, it's not doing its job, it's not getting the pressures, it's not maintaining the pressures, it's not doing what a bypass is supposed to do. It's just the fan giving them air. If you have it too tight, you can have bruising, you can have some facial trauma, as Mr. Porter was saying about the nose. He was like all the way down to the nose. Let's see, and also I've made this mistake because I didn't know what it was, but I felt the air. I put the BiPAP on the patient and I saw the air coming out through the exhalation port. At that time, I didn't know it was the exhalation port, so I blocked it for a little bit, but then I was like, wait a minute, I don't feel any other kind of air coming out. They weren't exhaling, I guess. So I let it go, and then I saw the pressure release. I was like, okay, so I guess occluding that is an issue. So I found out with experience, but then Mr. Porter said, hey, that's an exhalation port. Don't occlude that. So I'm like, all right, gotcha. Not occluding. Let's see. Now, easy way to remember what the IPAP and EPAP should be increased or decreased for is IPAP is for ventilation, EPAP is for perfusion, oxygenation. So you know the VQ ratio, it's V over Q. So if you remember IPAP over EPAP and then V over Q, you can just directly correlate. Okay, IPAP goes to V, EPAP goes to Q, so IPAP is for ventilation, EPAP is for oxygenation, perfusion. Normally increase in increments of 2. The IPAP and EPAP settings, or decrease in increments of 2, however you want to look at that. And then the tidal volumes, what you should hope to get, because you can't set a tidal volume on the Vision BiPAPs. You set a rate, and hopefully they breathe, because it's spontaneous breath. They have to breathe deeper if they want a deeper breath. So you coach them into it. Take, between 6 to 8 milliliters per kilogram of not ideal body weight, but actual body weight. What else? I believe that is all for BiPAPs. It's fairly straightforward. Looking over my notes here. I believe that is correct. Let's see. Yeah. I think everyone knows how to change the modes, go into the parameters, change how to do the IPAPs and the EPAPs, the rise time and the hold time. I think we all know how to do that. So I'm not going to go into that any further. And I guess if you have any more questions, you guys have my number and my email. Just let me know. This was a short video. BiPAPs aren't that difficult. Just remember ventilation, perfusion, IPAP, EPAP. That's about it. On the IPAP itself, it's got 3 graphs you can change to bar graph, line graph, auto normal, boop, boop, all that. Yeah, that's about it. Alright guys, if y'all need anything, let me know.